Hello, welcome back to Tuesdays with Tom. I'm Greg. There's a recent PIN that was just dropped, Provider Information Notice 2506 ASC, and the subject is calling 911 in residential care facilities for the elderly. So while this specifically pertains to RCFE, there are still some good bits of information that would be relevant for any residential care setting, ARF, group home, etc. So first, when to call 911. The PIN says that when imminent threat to health or severe injury or life-threatening conditions exist, you need to know each of your residents and respond to their needs. So understand their diagnosis. Understanding their diagnosis will help you make the best decision, the quickest decision that you can. Depending on an individual's health needs, they may be able to respond to you and say, you know what, I'm not feeling any pain, I'm not hurting, I have good mobility, everything seems okay. Can you help me up? That is a time when you wouldn't call 911. So alternatives to calling 911 would be when the situation is not an imminent threat to their health. And how do you determine that? Well, ask them, talk to them, see if they can move, see if they can help themselves up a little bit or sit upright. Things that you may want to consider though at your facility is maybe you have an appropriately skilled professional on hand, perhaps you employ a nurse. If that is the case, then by all means have that professional come and do an evaluation if it seems like it is not an imminent threat to their health, just to make sure. If there is access to a telehealth consultation, it is recommended that you try to make that happen to avoid an unnecessary trip to the emergency department. And if the individual is on hospice, then by all means contact their hospice provider if the injury does not look to be an imminent condition. If there is an injury, let the hospice nurse assist you in determining whether a trip to the hospital is necessary. Other points to consider in this provider information notice would be the advanced health care directives or the do not resuscitate orders. In the majority of cases where an advanced health care directive exists, where there is a DNR, 911 should still be called. It is not our place to determine whether somebody should or should not have access to medical care. It is up to that appropriately skilled professional to determine whether the request to forego resuscitative measures should be honored. And they should be honored if they exist. So if you have a resident with a DNR or perhaps a POLST stating that they do not wish to be resuscitated, then we honor those wishes and we make sure that documentation, in most cases the pink POLST, which is common among our residents, that should be given directly to any first responders, and any appropriately skilled professionals. To call hospice in lieu of 911 when a resident is experiencing some sort of life-threatening emergency related to their illness, that's typically the response you want to make. So somebody who has a terminal illness is on hospice, notify the hospice nurse if the life-threatening moment, if it looks to be that they are going into cardiac arrest or respiratory arrest, and they are on hospice and it is related to their illness, then hospice needs to be notified. But if there is something occurring that is unrelated to their hospice experience, then we do need to call 911. For an example, maybe you have a hospice resident in your facility and they fall and it is apparent that they've broken their wrist. We need to call 911 for that and then immediately call the hospice nurse to let them know. Another common occurrence where 911 is often called is for a lift assist. And it is understood that our non-medical staff are not necessarily aware of how to determine whether somebody has an injury or not. But we need to do the best we can to train our staff to make those decisions. And as I said earlier, if the resident is able to respond, if they're able to tell you that I don't have any pain, if they're alert, and it seems like they have decent mobility, then we should be able to have our staff assist in lifting somebody off the floor or assisting in helping them get up. That's not a time to call 911. That's an inappropriate time to call 911. But if we cannot determine that there is an injury, if it seems that there's pain, but we don't know if there's an injury, or if there was a fall that was unwitnessed where a resident was maybe knocked unconscious or they're confused, it's a good idea to call 911. That's a good time to do so. Now, the best approach to this is to make sure your staff are well trained. And this provider information notice is 8 pages long, and I'm going to encourage all of you to print it and read it. And as with many of these provider information notices, it is required that they are printed and kept in a location where guests and residents have access to them. A nice little component of this pin is that there is a summary. The last 2.5 pages of this pin is a summary that is intended for representatives and residents so that they understand our requirement to call 911. As we know, so many people say, don't call 911. We don't need to incur that charge. We don't need to disrupt our loved one's day. But we know that 911 is something that we should do when we're uncertain about the health condition as a result of a fall or some other imminent condition. I hope this helps. Thank you again for watching. And if you have any questions, feel free to send us an email or give us a call. Until next time, thanks for joining.